My head hurts. I mean, is there a more universal phrase? We've all said it right.
Absolutely. Whether it's just a dull ache or something that knocks you out completely, it's
Yeah.
a shared human experience.
But we need to start this deep dive with something, well, a bit foundational about pain itself.
Yeah, the thing about pain is,
Yeah.
it feels awful, obviously, but it's actually crucial. It's your body's alarm system.
Telling you, hey, pay attention.
Exactly. And it works using these specialized neurons, nociceptors, that are all over your body, basically detecting anything potentially harmful.
Like little tripwires for damage. They send a signal up to the brain.
And the brain interprets that signal as the feeling we call pain. It makes you react, pull your hand off the hot stove, that kind of thing.
Okay, but here's the twist. The really kind of shocking thing we found in the sources. The brain itself, it can't feel pain.
That's right. It sounds completely wrong, but the brain tissue itself has no nociceptors, zero.
So the organ that processes all the pain signals from everywhere else.
It can't feel pain directly. If you could somehow, bypass everything around it and touch the brain, nothing. No sensation of pain.
Okay, hang on. That feels deeply weird. How do we even know that for sure?
Well, we have really compelling evidence from things like awake neurosurgery. When they need to remove a tumor or something.
Right, I've heard about that. They keep the patient awake.
Yeah, precisely so they can monitor function. They might ask the patient to talk or move, maybe even play an instrument they know well.
While the surgery is happening?
While the surgeons are actually working on brain tissue, the patient is conscious, they're responsive, but they report no pain from the brain being manipulated.
Wow. Okay, that's pretty definitive then.
It really is.
So if the brain's out of the picture for feeling the pain, when I say my head hurts, what is actually hurting? Where's that signal coming from?
It's maybe called referred pain. It's coming from all the structures around the brain, structures that are packed with those nociceptors.
Like what specifically?
Well, think about the meninges. That's the thin sort of wrapping the membrane around the brain and spinal cord. If that gets inflamed or irritated,
Signal. Got it.
definitely. Also, the blood vessels, there's a whole network of them supplying the brain. If they swell or constrict abnormally, they can press on things.
Okay. Meninges, blood vessels. What else?
The paranasal sinuses, when they get inflamed, sinusitis. That headache is real, and it's coming from the sinuses.
Right, the pressure.
Exactly. And then there are the muscles and joints in your head and neck. Even your teeth can refer pain that you feel as a headache.
So the headache, the actual feeling, is like a chorus of alarm bells from all these surrounding areas.
That's a good way to put it. Medically, we call it cephalea. But yeah, it's the sum total of those signals firing.
Okay, so if the pain can come from sinuses or muscles or blood vessels, it makes sense that not all headaches feel the same. They must be different types.
Absolutely. And that's why classification is so important. Broadly, we divide them into two main camps.
Which are?
Primary headaches and secondary headaches.
Okay, what's the difference?
With a primary headache, the headache itself is the main problem. It's not just a symptom of something else. Think migraine, cluster headache, tension headache. Those are the big three primaries.
And secondary headaches.
Those are symptoms. They're caused by some other underlying issue.
Oh.
You treat the cause, the headache goes away.
Like, give me an example.
Dehydration is the classic one. If you don't have enough fluids, your brain can actually shrink just a tiny bit.
Seriously, shrink.
Yeah, slightly. And when it does, it can pull away from the skull, putting tension on those pain-sensitive meninges we talked about. Boom, headache.
Ah, okay. So the cause is dehydration, the symptom is the headache. Makes sense.
Right. Or headaches from infections, like sinusitis, or from a head injury. Those are all secondary. Fix the infection, heal the injury, headache resolves.
So the secondary ones are sort of easier to understand cause and effect-wise, which means we really need to dig into the primary headaches, the big three, where the headache is the illness. Exactly. Let's start with the most common one, the one pretty much everyone has experienced at some point. The tension headache, or TTH. Tension headache. The name says a lot. What does that feel like?
It's very descriptive. It's usually described as a kind of tight band, like a pressure or squeezing sensation, often around the forehead, temples, or the back of the head. Sometimes all over.
And I remember reading it often comes with muscle soreness, like neck and shoulders feel tender.
Yeah, that's very typical. Sensitivity in the scalp, neck, shoulder muscles often goes along with it. The exact cause isn't perfectly understood, but one theory is that people who get TTH frequently might just have a generally lower pain threshold.
So normal muscle tension feels more painful to them.
Potentially, yes. Their system might be more sensitive to those signals.
And what usually triggers this type?
Oh, the usual suspects of modern life, really. Stress is a big one. Poor sleep.
Hmm.
And a huge factor now is visual fatigue.
Screen time.
Hours and hours staring at phones, computers, tablets. It strains the muscles around your eyes and your scalp and neck. It's annoying, maybe even quite painful. But generally, it's not the most severe type of headache.
Manageable, usually. Okay, so if TTH is the most common and maybe least severe, let's go to the other end of the spectrum. The one that sounds truly awful, the cluster headache.
Ah, yes.
Yeah.
CH. It's sometimes called the suicide headache, which is a horrific name, but it reflects the sheer intensity. People who experience it consistently rate the pain as worse than things like childbirth or kidney stones,
Right.
even gunshot wounds.
That's hard to even comprehend. What makes it so bad? How is it different from just a really bad headache?
The pain is incredibly sharp, often described as piercing or burning. And crucially, it's almost always one-sided, located in or around one eye. It comes on very suddenly, very intensely, often waking people from sleep.
And there are other symptoms just on that one side too, right?
Yes, exactly. Things like a drooping eyelid, the eye might get watery and red, maybe nasal congestion, facial flushing, all on the same side as the pain.
And the behavior during an attack is really distinctive too, isn't it? Unlike a migraine where you want to lie still in the dark.
Right. People having a cluster attack often can't keep still. They feel intensely restless, agitated. They might pace the room, rock back and forth. Some even report hitting their head against things out of desperation.
Just trying to counteract the internal pain. It sounds absolutely brutal. Do we know what causes something that extreme?
It's not as well studied as migraines, partly because it's much rarer, but research points towards involvement of the hypothalamus.
The hypothalamus, isn't that like the body's master clock, circadian rhythms and all that?
Exactly. And that makes sense because cluster attacks often happen with eerie regularity. They might strike at the same time each day or night, sometimes during specific seasons of the year. It fits with a disruption in that deep biological clock.
Wow. Like a faulty, excruciating alarm clock in the brain?
Something like that. The precise mechanism for why it's so intensely painful isn't fully clear, but the link to the hypothalamus suggests a very deep-seated neurological storm. Okay, so TTH is common pressure, CH is rare, intense, localized agony. Let's talk about the third big one, maybe the most complex, migraine. Right. Migraine. This is way more than just a bad headache. The defining pain is usually pulsating or throbbing, often on one side of the head, but it can be on both.
But the key is the other symptoms that come with it.
Absolutely. Nausea is very common, sometimes vomiting. And extreme sensitivity to light, which is called photophobia, and to sound, phonophobia, sometimes even sensitivity to smells. It forces people into quiet, dark rooms.
And migraines often have stages, right? It's not just the headache part.
That's right. Not everyone experiences all stages or in the same way, but classically there are four. First is the prodrome.
Morning phase.
Yeah, it can happen a day or two before the actual headache.
Mm-hmm.
Subtle signs like mood shifts, maybe food cravings or loss of appetite, neck stiffness, feeling tired, maybe slight nausea. Your body's hinting that something's coming.
Okay, then what?
Then, for about a quarter of people with migraine, comes the aura. This happens shortly before or sometimes during the headache itself.
And this is where the weird neurological stuff happens.
Exactly. Most commonly, it's visual disturbances, seeing flashing lights, zigzag lines, maybe blind spots. But it can also involve sensory changes like tingling or numbness, sometimes even temporary weakness or difficulty speaking.
That sounds quite scary, actually. It can be, especially the first time. Then comes the main event, the attack phase. That's the headache itself, the throbbing pain, the nausea, the intense sensitivity. This can last anywhere from a few hours to several days. Days. Ugh.
And after that, finally, there's the postdrome. People often feel completely drained, washed out, maybe confused, sort of like a hangover after the storm.
Though I read some people feel weirdly euphoric afterwards.
Yeah, that's reported too. Possibly just immense relief that the pain is finally gone.
Okay, so what's going on in the brain to cause all this? You mentioned a hypersensitive nervous system earlier.
That seems to be the core issue. The thinking is that people prone to migraines have nerve cells, particularly in the brain, that are just easier to set off. They fire more readily than in other people.
Like they're constantly on edge?
Kind of. And this hyperexcitability seems to do two main things during a migraine episode. First, it leads to waves of abnormal brain activity spreading across certain areas.
Yeah.
That's likely what causes the aura symptoms, the visual stuff, the sensory changes.
Okay, that explains the aura. What about the pain itself? That throbbing?
The second consequence is the abnormal activation of the trigeminal nerve. This is a huge nerve pathway responsible for transmitting sensation, touch, temperature, and pain from your face and head to your brain.
Oh, okay.
In a migraine, this hyperexcitable system causes the trigeminal nerve to basically go haywire. It starts sending excessive, constant pain signals even when there's no actual injury. That barrage of signals is interpreted by the brain as intense, pulsating pain. It also triggers the release of inflammatory substances around blood vessels in the meninges, adding to the misery.
So it's like the nerve is stuck in the on position, screaming pain
That's
signals.
a pretty good analogy, yes.
And the triggers, stress, lack of sleep, those seem common for many headaches. But migraines have specific sensory triggers, too. The source mentioned a disco analogy.
Yeah, that captures it well. Bright flashing lights, loud noises, strong smells. Basically, sensory overload can push that already hypersensitive system over the edge into a full-blown attack for some people.
And there's a hormonal link, too, isn't there? Especially for women.
A very strong one. Fluctuations in estrogen levels are a major trigger. That's why migraines are much more common in women, and often linked to their menstrual cycle attacks might happen right before, during, or just after their period.
It's incredibly complex. Is there a cure?
Unfortunately, no cure yet, but treatments have come a long way. There are medications to stop an attack once it starts, others to relieve the pain and nausea, and also preventative treatments to reduce how often people get them and how severe they are.
Okay, so let's try and pull this all together for everyone listening. We started with that simple phrase, my head hurts.
And we've seen it's really not simple at all. It covers everything from, you know, your brain pulling slightly away from your skull because you forgot to drink water.
All the way to these complex neurological events like cluster headaches originating near the body's master clock, or migraines involving a hypersensitive nervous system and runaway nerve signals.
Exactly. It's a huge spectrum. But I think the core takeaway, the really useful thing to understand, is the fundamental neurology. Knowing your brain doesn't feel pain, that the pain comes from surrounding structures.
The meninges, the blood vessels, the muscles.
Right. Understanding that mechanism, those nociceptors acting as alarms, it just gives you a deeper appreciation for what's happening inside your own head when you feel that pain. Even if most headaches are, thankfully, benign and treatable.
It definitely reframes the whole experience. And just to leave you with something to chew on, our sources mention an interesting point. Some people seem prone to chronic stomach issues or gut pain, while others are more prone to headaches.
Yeah, it raises a fascinating question, doesn't it? Why does the body's alert system seem to favor the head as the site of distress for some individuals and maybe the digestive system for others?
Is there some kind of inherent neurological wiring that makes one area more likely to sound the alarm than another? We don't really know.
But it's definitely something interesting to think about, why your body chooses that particular way to tell you something's wrong.
Food for thought until our next deep dive.